As we inch closer to the availability of a COVID vaccine, what will the timeline look like for residents in Connecticut, residents of Connecticut, and are we prepared? Joining us now, Senior Director of System Pharmacy for Hartford HealthCare, Eric Arlia. Thanks so much for being here with us today.
Thank you for having me.
As we continue learning more about the vaccine and its availability timeline, what can you tell us about them?
So the two vaccines that are currently being reviewed by the FDA from Pfizer and Moderna, very effective, very promising new results, up to 95% efficacy. One of the important things to know about them is that they're frozen vaccines, so there are a lot of logistical issues that need to be accounted for in order to get them into our COVID vaccine clinics.
And what kind of preparations are being made at Hartford HealthCare to manage the storage of the vaccine exactly if and when we do get it?
So, you know, we've been following the story for the last few months. There's a little bit of a difference between the two vaccines. The Pfizer vaccine is stored at what we call ultra cold, which is about negative 100 degrees Fahrenheit. The vaccine from Moderna is about negative 20 degrees Celsius or 0 Fahrenheit. So we've invested in some additional freezers that can accommodate both vaccines so that we would be able to store as much as we are allocated for and then be able to distribute them throughout our system to support the clinics that we're going to be planning.
And obviously, as we continue talking about the two different vaccines, are they single dose or will more than one be required? How will it be distributed?
So these first two vaccines from Pfizer and Moderna are both two series vaccines. The Pfizer vaccine, the two doses should be 21 days apart, and the Moderna vaccine is going to be 28 days apart. And it's really important for everyone to keep in mind that all of the studies that we've been reading about and the efficacy rates really are based on patients getting both doses of the vaccine. So, you know, I can't stress enough how important it is to make sure and follow through and get that second dose scheduled when the time comes.
All right, Eric Arlia, thank you so much for joining us today.
Thank you. Thank you for having me.